the word elective seems to imply to some people that these are surgeries that aren't really necessary, but that's not true. These are patients, some of whom have cancer, some of whom have serious orthopedic injuries, including Eric. These are patients who need these procedures, that need this care. And so this time we've made a decision that we are not going to defer elective surgeries if we can avoid it. And so where does that leave us? Well, we've got to figure out how to get staff back to work. And so we've declared that we're in a crisis, we're in what we call crisis staffing. The CDC has given guidance to hospitals and health systems based on each system's assessment of where they are and what they need to be doing. By declaring crisis staffing, there's a few things that triggers for us. Number one, if an employee is at home, if they've tested positive with COVID but they're asymptomatic, our expectation is that they will come back. And we will deploy those team members where appropriate to help support our clinical staff. If they're clinical, it's possible they can come back and work in a COVID unit. It's possible they can work in the emergency department as a sitter when we have mental health holds. As I've mentioned, some of our hospitals, 20% or more of our ER visits on any given day could be mental health holds. And each of those requires a one-to-one sitter. And when we're using clinical staff to do that, it's obviously, it manifests in expanding and exacerbating our shortages.